Good morning, everyone.
Morning.
Morning. My name is Lucia E, and my matrix number is 184x17.
My name is Ong Ling and my matrix number is 183058.
And my name is Lu Puyan and my matrix number is 183647.
My name is Gong Wei and my matrix number is 183241.
So today we have to discuss about a topic, organ donation. Is that necessary for everyone to be an organ donor? So what is your guys' opinions about this topic?
Yeah, so at first, before starting the topic, I will give the definition of what is organ donation. And organ donation is actually the donations of tissues from or an organ from a human body and transplant it to another person to maybe prolong the life of that person.
Can you give any examples for the organs that we can donate?
For example, the hearts and lungs, and also the liver, kidneys, or other tissues like tendons,
Blood vessel.
blood, yeah, tissue.
Blood donation is still considered as organ donation.
No,
I think
blood
that
donation
is tissue donation.
Blood is tissue donation.
I think.
Is it true? But I searched the internet, I didn't see the tissue donations that include the blood.
If not mistaken, from the searching from the internet, I saw got 3 types of donation. One is blood donation, tissue donation, and organ donation.
But now we mentioned about the organ donation, so it should not be related to the blood donation. Okay. For my point of view, just now you mentioned that is it everyone that necessarily have to donate, has to become the organ donor? And for my point of view, I don't that everyone are necessary to donate. Like, even though that to become an organ donor is a sophisticated and very heroic act that can save up to 8 people's lives. And if you donate the tissue, right, you can save up to 50 people. Like across the country, you don't know who is it, but you can save them. And so my point is, I think that it depends on the family choice, because some of the family they will be think that if it is been more like they've been through a lot, they see their patients, that their parents, their member maybe died already, they already very sad, and still have to face the issue that they have their patient, like the patients need to, like their parents need to amputated, and then the organs being transferred to another country, like they don't have a whole body. It's not good for them.
Is that you means the decision to be an organ donor is depends on the families but not the individual themselves?
Okay. Yeah.
Can you classify more why you disagree to be an organ donor, except for the family?
Because according to the religion, right, although it's a very good act of charity, but doesn't mean that the family will be accept that. Like the relatives and family, and also maybe the individual itself, they not mention that maybe the body is the organ, they are not actually donated to the recipient. They only put in for the medical research. Maybe put in the facilitator for the few weeks or month for the medical student to do the research. And
that also benefit.
I know that is benefit,
a lot of
but it's still not good. Like if they see her family, right? Their body they put into the theater and seen by everyone. It's not good, lah. For my opinion, lah, it's not good.
I agree your point that the decision to be an organ donor is need to depends on the families, because not every family member can accept that their own children or family members to donate their organs after they die.
Yeah.
But but because although that organ donation has no age limit, but after 18 years old, the individuals can make their own decision. Is it they want to be an organ donor, even though families members are not really
want them to donate the organ.
not really agree them to be an organ donor, but the decision is still depends on the individual, since they are grow up, they are reach the age that they can make their own decisions correctly.
I agree on both of what both of you say. But I think that if the patients, not the patient, the organ donor is maybe more than 18 years old, then if he or she made the decision to become an organ donor, then if any accident happen, then still got the situation that say that the parents still do not want them to their organ to be donated. Because I read from internet or heard from others that say that even though the organ donor already registered to be the donor, then after that they made an accident or what, then they want to when the doctor want to uh, do the operation to transplant the organ to another person, then the parents or their relatives still do not want them to donate.
But before that, is it the girl already signed
Yeah.
up for?
She already registered, but maybe she do not ask from the parents whether they agree that they need to do the organ donor.
But since she had already signed up for organ donation,
Yeah.
they can't change the decision, right? Even though the family
No.
members.
No, my opinion is not like that. Because I got search, right. That one is for the presumed consent of the organ transplant. Actually, after the person is deceased, right, the doctor is still need the authorization from the parents.
Because even though the person's already registered for the as an organ donor, but they still can change their decision before
Yeah, before
before the
donate the
their death lah. But does anyone here register for the organ donor?
I
No.
plan to register on my birthday, which is 8th of May. Since I'm already 21, right, and I plan to register. But I don't think I will tell my family lah. Maybe I will talk a little about it. Because I think that they don't take it serious. Maybe they just think I'm playing only.
But it is necessary for you to tell your family because after you
Yes, I will slowly,
Okay.
after I register.
persuade them.
Yes, persuade them. It's really good because from the patient view, they need to wait. They have a long waiting list, right? And they need to wait for a suitable for the suitable and compatible organ, and for a suitable time and enough money to get the organ transplantation. So I can feel that the patients are all longing for a new life. So So why don't I donate it after I'm dead? Because my organ is useless already, you know. It's just buried down or just burn.
Burn cremated.
Yeah.
You are
Yeah.
right. You are right. I agree that because once you have that, you have no feelings at all.
Yes.
The organs is already unuseful for you. So why not you just donate your unwanted organs to the person who need the organs urgently? Because I do the research that there are more than 2 million people that are still waiting for the organ suitable organs for them to do the plantation just for enhance their life. So I think this is I support that everyone's to be an organ donor since on average from the patient from the Asians or the black patients their wait almost 1 year or more than 1 year only just wait for an organ like kidney. So I think this is quite meaningful because organ donation is like an act of love and save and enhance people's life. It's really
It's the last gift. It's the last gift you give to this world.
and contribute to the population.
You're really right about some point about the disease donations. But how about the living donations? We still need to consider about the surgery complications. For what I mentioned just now, no, have I mentioned before? That one, if for the living donation, right, the persons maybe need to do the surgery and donated the part of maybe portion of the organ like liver to another patient, to the recipient, right? They need to consider about the side effect. Sometimes the side effect is very annoying and dangerous risky to the organ donor and also for the recipient. Even though their blood type are matched, but doesn't mean that the organ is compatible to the recipient. The recipient they have their own immune response. They may be attacked to the new organ. So
For the case you mentioned, if for me, I will accept the risk if my part of the let's say kidney I will donate to my family members. I will accept the risk because it's my the people around me who is close to me next to me means I still will accept the risk for doing for the living donations, but just for my own family members.
you got your point. But both of them also taking risk. They after the organ plantation, right? They not guaranteed they both are like the recipient. Recipient maybe after they having a surgery, maybe he will having the rejection, right? So maybe it die in within 24 hours. We don't know.
The rejection most probably only will occur for the strangers or totally different ethnic or the person somewhere around the world that is really far away to the DNA. But if let's say it's for the next to the kin, the close person or family members, the probability for the rejection is little only.
So most of the time, the living donations is donated to the recipient from another country, right?
Yeah, sure.
So we should be consider the rejection part.
That's why I mentioned if for me I will only donate for my family member.
Okay, you got it.
For the living donation.
So, before we continue, may I ask a question? Do you guys prefer living donations or disease donations?
Of course, this is donation because there will be no pain. And since since I scared of blood, scared of pain, and also if living surgery, living organ donation, right? Just like what you said, there will be many risks. So the risk will be very, very low after, I donate the organ after I dead, right? So I will prefer disease organ donation. How about you guys?
For me too, I also think that disease donation is much more is better than living donation because I also get off the pain and also I maybe do not want to take the risk because of after doing the operations after donate the organs, then I'll maybe get some problems like maybe you do not feel well and that will also trouble your family member.
As like I said just now, I will not do. I will prefer for the disease donations rather than doing for the living donation. But if let's say in case that my family members need the part of the organs that I can give to, then I will do it.
Yeah.
So obviously, I also agree that the disease donation is better than the living donations, and the point is much more same like most of you.
Yeah. If really my family members need my organ, then I will donate them.
But since you already planned that you're planning to register for the organ donor, then how about you too? Do you have the mind that you will or you're going to register for as an organ donor?
Yeah. Actually, I have think before we discuss about before we discuss this topic, and also before when I'm still in secondary school, I have already considered this problem, this issue. Actually, have the I have the thing that to become to register become an organ donor. I don't know whether I have discussed this about with my family. I also forget their answers, so maybe I will ask them another time.
And how about you?
I feel that maybe I will plan in the future to become an organ donor.
In the future means
I still need to consider about it. Okay.
okay.
But
However, you are not you disagree for this.
I'm not totally disagree, but I feel that maybe I will become an organ donor because before that I got search the YouTube, right? I got watch a few video like the organ donations from a boy. I mean from another country, right? That a boy, I don't know whether is around 8 years old, and he died in an accident. And the girl, he's a ballet dancer, right? She have a bright future, but suddenly she got I think it's a heart disease problem. So she need the heart immediately. So by that time, his friend, right? His friend died in the accident. So that boy is donated the heart to that girl, so she can foresee her life. And when the mother touched that recipient, that little girl heartbeat, she cried. She cried out. She's so sad. I can see, but she's very happy.
I also want to say about this because I just going to tell about this story because the mothers donate her own children's heart to a stranger, but she got the opportunity that she can hear the heartbeat of her own sons again.
She
It's really touching
touching.
that because she never know that she still have the chance that can hear again the heartbeat from her own
She
son.
just can feel like her son is still
Alive.
beside her and
So
still living happily.
and this one
with
is
another girl.
this one is also another chance to maybe like the girl is the stranger, right? And they can become a friend after.
Or can become your
Become her another daughter like that, and bring her out like that. Create and how to say, maybe a love for another.
You mean that it will be influence another people to be organ donor?
Even the cornea also.
Yeah.
Actually, in the list of the organ donor, right? I think they have a few options that you are agree to donate which organ. You can
Yes.
choose. Like last time I saw one uncle, he only take skin, bone, and what else? Yeah, he didn't take for the heart, lungs, the important organ because he thinks that once a people die, actually it's a process that we are need to care and respect. For the traditional view like for our Buddhist view, they concerned about the death process. Like we will pray and how to say then is
Before they bury the dead, they will have many process to do during the funeral.
yeah,
Yes.
so they not really agree that the person is incomplete without the organ.
So you mean the funeral during the funeral process, right? The person, the death, right? Maybe in the open casket, right?
No. Actually, I checked. They will do again the recovery for the death after they do the organ donation. So you will be seeing a whole complete
And the whole
dead body.
But inside is empty.
But
Yes, maybe I
for her
didn't
story,
see it
he
before.
uncle, right?
Yeah.
Donated the skin, no, I mean the skin how to recover and
That question you need to ask doctor.
okay.
I think just part of the skin because not every skin
part,
can.
yeah.
I think maybe
Part of the skin.
so left the
Maybe the
Epidermis or
epidermis
the
inside.
something like that.
Maybe the
Did you heard about the Selena case?
Oh,
She just
oh.
used burn something from the skin of
Another
of
part
her
of
head.
head
Yeah, head.
I thought it's
Yes.
somewhere here.
No. Her head, and then she used it
And
to use for the skin for the body. Yes.
I just heard about from the skin from here then
No.
cover
It's
the
head.
face.
It's head.
Let's say the face is
So you not really use all the skin. It's just the little bit part. Maybe just the skin tissue, skin tissue. Just like cornea transplantation,
so you put the plastic eyeball inside.
impossible you took the whole eyeball to donate, right? Just like cornea transplantation.
The cornea
You only use a layer of cornea,
Oh.
yes, to donate. So your eyes is still there, but you don't realize it is lack of cornea.
But for me, I think that that one is tradition. The old people think like that, but for me, I think that we still can donate, and I think it is not important that our organ is incomplete after that, and when we do funeral, and we need maybe from traditional is they want to be complete body, right? But I think that is not important, as I can help people, and I prefer more to the funeral not like inside the
Mean the body
Yeah.
being cremated, they put it in the
yeah
young or what?
not maybe burn the dead
Just
body.
burn.
I prefer that. I don't
Rather than bury.
bury under because that one is not
Costly.
costly
Yeah,
and
not
also not
environment friendly.
yeah.
So until now, we both, three of us agree to become organ donor. But how about you? Did you change your mind?
I think I also agree that about the disease donation lah. But for the living donation part, I still consider about that. I still disagree that.
And I need
There's
to
still a few risks, few problems that need to deal with.
Reconsider.
yeah. I think I add another thing. Why we donate our organs is because maybe we don't know right. We maybe will make what evidence in the future. So yeah, if the doctor already justified that maybe our brain already dead, then it is useless for us to still living on the world and also trouble the family members, and because they need to come to the hospital and to clean our body and to take care of us. If we already been justified that our brain already dead and we cannot work and cannot live like a
Normal
life
person. Normal life.
live normal people, then we should our family members should maybe help the one who already cannot be a normal person to do some charity.
I see what you mean lah. But actually, for this case, right, maybe it will be make the parents more suffer because she had to decided to take off the flag, right? That
Yeah.
one. So to end up the patient life, it's not that easy actually.
Yeah.
I think we are going too far from the topic. Sorry for interrupting.
Okay, sorry.
Okay, so we have done our discussion, and what is our conclusion
After listening to
of
everyone's opinions, we are come to a conclusion that we are agree for the organ donation, but the decision to be an organ donor is depends on the individual circumstance. But not only individuals, but you also need to discuss with your family members.
and most of us will be an organ donor after we dead instead of when we are living, because the risk is very high if we being a living organ donor.
Since there are 2.2 million people die every year, but only approximately 2% are organ donors. So we are really support that everyone to be organ donor.
Thank you.
Anyone to add on?
No, because already made conclusions. Okay.
但是我觉得
Thank you.